The call to end mercury amalgam in Medicaid, a policy brief from the Preventive Dental Health Association. Federal guidance now urges the elimination of mercury amalgam. On July 28, 2026, the U.S. Department of Health and Human Services stated that programs should restrict or eliminate reimbursement for these materials in order to reduce unnecessary toxic mercury exposure patients. Traditional amalgam continuously releases toxic vapor. It is 50% elemental mercury and releases vapor for the life of the filling. The FDA cautions against amalgam use in susceptible groups, including individuals with neurological conditions, children under 6, pregnant women, and those with impaired kidney function. A single mercury filling can cause an adult to exceed state safety limits. According to the 2022 Geyer and Geyer study, this affects an estimated 86 million adults. Public funding should not mandate compromised safety. The federal notification correctly identifies mercury amalgam as a material that should no longer be supported by taxpayer resources. That is according to Scott Andrews, president of the PDHA. The clinical standard has shifted to biocompatible materials. Mercury amalgam contains 50% mercury and carries high vapor release risk, with official FDA warnings. Biocompatible alternatives like resin and ceramics contain zero mercury, have low or no systemic risk, are approved, and are suitable for vulnerable populations. Removing existing amalgam generates elevated mercury vapor, creating both patient exposure risk and staff occupational hazards when proper controls are not used. Decades of studies confirm the negative impact on patients and dental employees. Safe removal requires specialized engineering controls, specialized equipment, additional time, and advanced techniques. The solution is the PROTECT protocol, created by the International Academy of Biological Dentistry and Medicine. Safety cannot depend on out-of-pocket payments. Critical protective removal safeguards are currently not covered under standard dental fees. Medicaid programs must authorize and fund these measures to ensure equitable safety for all patients, regardless of their ability to pay. A 3-step mandate can protect Medicaid patients. First, stop amalgam codes by eliminating coverage for all mercury amalgam procedure codes without delay. Second, fund biocompatible alternatives by directing resources exclusively toward non-mercury restorative materials. Third, reimburse the PROTECT protocol by establishing funding for specialized protective removal engineering controls as standard practice. Advancing biocompatible, science-based oral health. A clear and prompt transition is essential to end the placement of this toxic material in the mouths of those with the fewest treatment options. The Preventive Dental Health Association is dedicated to preventive oral health strategies that support systemic health and longevity. Learn more at thepdha.org.